My name's Anna Kearney, and I'm a researcher at the University of Liverpool. And I've had a bit of interest in recruitment and retention, and I've been working on the ORCA project, which we're going to talk about now, the last 2 years, taking over from Nick Harman, who's also from the University of Liverpool. Okay, so what I'm going to talk about today is mapping the recruitment literature and what's next. Obviously, many of you will be aware that recruiting patients to time and target within clinical trials is a well-documented and frequent challenge. And so over the last couple of decades, the amount of literature discussing recruitment has significantly increased, but actually navigating that literature can be very difficult and time-consuming, especially if you're looking for interventions for a particular trial design or patient population. The ORCA project aimed to create a searchable online database of recruitment research. Now, I don't necessarily want to go into the methods in any great detail because I have actually done another webinar a couple of years ago on ORCA, and a lot of the methods information is contained in that webinar, which can be accessed from the HTMR website. But for those of you that have never heard of ORCA or not familiar with it, essentially we undertook a large-scale literature review. We developed database-specific search strategies based on those used in Sean Truick's 2010 systematic review of recruitment interventions. These searches are run in the following databases listed on this slide in January 2015. And we were looking for eligible studies that either evaluated or reported the use of recruitment interventions. But we were also interested in studies that explored recruitment successes and failures, along with motivations for participating in clinical trials. For each eligible article, we then went about and extracted data on things like the research methods, the nature of the host or the design of the host trial within which the recruitment research is being evaluated, and also the publication details so people can access the full text if they're interested. We had a team of reviewers who were very involved in this, and they were assessing the eligibility of articles, but then also categorizing eligible articles according to the level of evidence. It's worth noting that we didn't assess bias in any of these articles, and we've left that for the users of the database to do for their own purposes. But what we did want to do is to be able to categorize eligible articles so that we could pull out particularly studies that were evaluating recruitment strategies and giving evidence for effective practice. So articles were categorized to one of 3 levels, and the levels were evaluation, which was the formal evaluation of a recruitment strategy, particularly through a nested randomized control trial. But that also included systematic reviews of those nested randomized control trials. Level 2 included studies that reported recruitment strategies, but there may have been an informal evaluation, such as a pre-test or post-test comparison, or there may have been no evaluation, but there was sufficient descriptions of methods involved in that article. Finally, articles were categorized as level 3 if they looked at factors affecting recruitment, but didn't really describe a particular strategy. So this would include some articles and trial reports that described recruitment successes or failures, but didn't focus on a specific strategy. It also included articles talking about reasons for participation or refusing participation. And then finally, the reviewers also categorized articles against a predefined recruitment schema, looking at recruitment themes and domains. There's about 42 domains that were grouped under 5 headings. You can see them there: novel trial design, pre-trial planning, trial conduct, information needs, recruiter differences, and incentives. And this PDF is available on the ORCA website if you want to look at it in any more detail. So moving on to the actual results, as you can see from the Prisma flow diagram, is a large-scale literature review and quite an undertaking. We screened 56,000 abstracts and reviewed 4,500 full-text articles, and of which we found 2,804 articles which are eligible and added to the database at that time. If we look at the cohort, we can see that the articles included recruitment across all continents. So this is quite internationally relevant, but obviously a lot of the articles focused on recruitment within North America and Europe. As you would expect, publications increased dramatically over time, and the top journals for publishing recruitment research were very trial specific, although you can also see there were a lot of cancer, there were some cancer journals and epidemiology journals as well. But we included articles from a very broad range of journals, as you can see there, with the top one only covering 4% of the included articles. If we look at the articles by the level of evidence and the categories there, we see that only 160 or 6% of the articles we included actually evaluated recruitment interventions through a nested randomized control trial. 2/3 of the included articles covered lessons learned and factors affecting recruitment. So whilst there is a wealth of recruitment literature out there, not a lot of it is directly reporting recruitment strategies or methods in any detail. If we go on to look at the most frequently used domains, we actually categorized 7,060 domains across the 2,804 articles. So remember that articles could have more than one domain associated with them. Frequent domains included barriers and facilitators identified within trial conduct, but also identified within pre-trial planning. Now, we appreciate these are very broad categories, which will likely have contributed to them being used frequently. However, this is also linked, I think, to the large number of case reports that we saw in level 3, which describe recruitment successes and failures. And that's why they are perhaps the most common domains. Cultural considerations was also frequently recorded in both a trial conduct, but also specifically in relation to recruitment information needs and translation of recruitment information. And this again will be linked to the large volume of American research where inclusion of minorities is mandatory. But also of interest, you can see there was a large number of articles exploring both the identification of trial participants and also trial marketing. And we found a lot of articles were sort of reporting the numbers of people recruited and the potential cost of identifying people from different sources, including primary care, secondary care, use of radio ads, newspaper ads, social media, that sort of thing. And there were a lot of articles in the database about that. If we look specifically at the domains in level 1, one of the things that we were particularly interested in terms of understanding what evidence there is out there for effective practice, we can see that the majority of articles in level 1 actually focused on domain group D, which covered recruitment information needs, and I've highlighted that in the green box there. If we look at the actual frequencies, we can see the most common domain within level 1 articles was actually the delivery of recruitment information, closely followed by the content of participant information, which is also linked to obviously the consent process and technology there in terms of looking at how that information is delivered. Is it through websites, DVDs, etc.? The one that's also involved there is also participant incentives, which is also a commonly evaluated strategy. And it may be that this is a common focus due to initiatives such as the MRC Start, which have been encouraging uptake of SWOT in this area. So thinking about this a little bit, about future research and what this means and where we can go. Well, obviously there has been a lot of research on optimizing patient information and looking at the recruitment recruitment information needs. However, It was interesting in the recent publication of the priority study, which was looking at recruitment research priorities, that actually recruitment information needs came out in 4 of the top 10 research priorities. So it's clearly a topic that is of great interest and still needs to have a lot of research done in this area. Similarly, many of you will be aware that Sean Truitt has updated his systematic review. This was the systematic review that we had based our search strategies on. And he published a new version of this in 2018, earlier this year. This systematic review was done in parallel with the ORCA project, and they actually grouped the studies that they found using the ORCA domain headings I described earlier. The exception to that was that they split the Group D, the recruitment information needs, into 2 different headings, which looked at consent process and information needs specifically, and optimizing patient information. For those of you who read the study, you'll know that out of the 68 studies, they identified 8 to do with the consent process and 35 actually addressed information needs. So there's still a lot of studies, there's a lot of work still going on in this area. But if you've read the report, you'll know that it does highlight concerns about the quality of these evaluations and suggests that only 3 out of those 68 studies give any high certainty of evidence, and actually encouraging us to do more robust studies to give better evidence in this area. But we also want to think about some areas that have not been explored, not just building more research on the recruitment information needs, but what areas we have missed that actually could do with exploration. If we go back to the graph that I've got on the screen about about level 1 domains, I appreciate you can't read all the small text, but there were no articles looking at recruiter acceptability of trial site eligibility, sample size estimation, importance of outcomes for patients or recruiters, organization, or the impact of the organization, and recruiter equipoise. So none of this was covered within level 1, within formal evaluations. Now, we appreciate that actually some of those topics would be very difficult to cover in a nested randomized control trial, and so that's why they perhaps aren't seen in this graph here. So if we go on to look at adding in level 2 data and seeing how frequently these domains were used in level 1 and level 2, we see some of those that were missing were discussed more in level 2, showing that the trials community is discussing their impact on recruitment. But there were still some topics that actually weren't covered very much. Trial site eligibility, the importance of outcomes to patients, and the importance of outcomes to recruiters and recruiter equipoise, whilst not covered in level 1, were rarely also covered in level 2. And so these could be areas to really explore. And it's interesting that obviously there's a lot of work being done on outcomes at the moment, but it's clear they've not been evaluated against their impact on recruitment. Now, I think there are some studies in process on this, so if you're involved in that, then please do mention those in the chat, and do send us the reports of those once they're available. Similarly, there are also some topics that were covered in level 1, but actually by the time you add in level 2 data, there's still not much information out there about them. And that would include patient-clinician convenience design, so designs of trials that just make it easier for patients and clinicians. The reporting of trials and how that impacts on recruitment. And then finally, trial site assessment and factors, which is linked to trial site eligibility. How does the choice of trial site impact on recruitment? And these would be some areas that we would really encourage research in and to explore. And the next time we update this, it would be great to see more research within these areas. So all of this research that I've covered at this point has been published very recently in clinical trials, and that's the publication details. You can also get those off our website, and you can look at these in further detail. The report also contains some information on the uptake of the website, which I wasn't planning on covering today, so that would be good to look at. Now, obviously, many of you will be aware that actually it takes time to get articles published. So whilst this has been going through the publication process, we have actually updated the ORCA website with 2015 and 2016 publications. And now there's 3,547 papers on the website that you can search against different health areas, different genders of patients, etc. And you can really hone down and try and find specific papers that you might be interested in. We have taken the opportunity to undertake minor revisions to the recruitment domains that I showed you at the beginning of the talk. Just briefly, most of them are text changes just to make it simpler. For example, we've highlighted these in red. So we've removed novel from novel trial design. We've removed alternative from alternative technology. And we've clarified that E5 is trial site factors rather than assessment. But we have added 3 domains, which we've been using in this last update. Other trial designs, and particularly under C10, we've added a domain on electronic health records because we recognise this is a kind of growing area and is particularly used in recruitment of potential participants to clinical trials. And so we wanted to be able to capture that and allow people to pull out articles on that. We've also separated out the participant incentives to monetary and non-monetary incentives. So hopefully these will be applied in the updates and will hopefully improve the experience. We are also planning to update the database with 2017 publications. This will start shortly. We've delayed slightly because we wanted to take the opportunity to review our search strategies, and we will hopefully try and complete that review by the end of the year, or if not early next year. And finally, we've acquired funding to extend the ORCA database to include retention research. That's a major undertaking that we're in the process of at the moment. Because obviously it's very important to get participants into clinical trials, but there's an equal challenge to ensure that they're retained and provide outcomes. So I'd encourage you to look at the ORCA website if you haven't, that we're constantly trying to add things and tweak it. But there you can search and access all these articles that we've talked about. And we also will try and keep you up to date with progress on the About section. We're coming towards the end of this now, but we want to say a massive thank you to everyone involved. As you can see, it's been a massive undertaking, and we're very grateful, particularly to the funders, the HTMR, but also to the Health Research Board, Trial Managers, Trial Methodological Research Network in Ireland. Apologies if I got that wrong. And also everyone involved in the abstract screening and full text review. We've had a lot of volunteers who've given their time, and we're very grateful. And I just want to use the opportunity to give a quick plug for anyone that might want to be involved in ORCA going forward. We're always looking for reviewers to work with the recruitment database, the retention database, or both if you have the capacity. And we are looking for people with methodological research experience because we want to maintain the quality of the database and the work that we're doing. But we recognise that there is a distinction between the abstract review and the full text review. So if you have any PhD students or PhD colleagues who are working on methodological research but are very early on in their PhD, then we would suggest an abstract review would be a great place to get involved, to get more understanding of the literature and to gain valuable experience in this area. We do give training, written guidance and ongoing support to everyone, and everyone is acknowledged on the website, publications and presentations, as you can see. But there is also opportunity for authorship on publications if people reach a pre-agreed threshold of reviewing articles, and we can supply more details on that if people are interested. So that's a little quick plug at the end, but wanted to open it up to questions now, and those are my details if anyone's interested, or you can contact us through the Orca website. But if you would like to ask a question, I think please either post in the chat that you have a question, or you can write your question in the chat. And I think if we can hear Chris, if Chris's microphone's improved, I think she will try and share that. We'll see how that goes. Okay.
Yeah, thank you, Anna. That was very interesting. Can you hear me better now?
I can hear you a lot better. I will. Yes, people are saying yes on the chat, so that's good.
Okay, I'm not quite sure what was wrong the first time, but I fiddled around a little bit while you were talking, and it seems to have solved the problem. So thank you for a really interesting presentation. As Anna said, it's now open to questions from anyone who is listening in today, so you can either type your question or unmute yourself and ask directly. While we're waiting to see if any questions come in, I wondered if I might start, and obviously you've been developing the database and the Orca database for a good while now. Could you give us some idea, what's the sort of uptake been on its usage, and do you know how it's being used?
Yes, certainly. So obviously there are some figures in the report that I mentioned, the Orca publication and clinical trials.
Yeah.
But the more updated figures, I guess, because Orca's been running now for 2 years. The website was launched in August 2016, I think. And yeah, I think looking at the figures, it's been accessed, I think, about 1,700 times by about 1,900 users. I'm just trying to look at my notes here.
Yeah.
In the last year, I think we're very pleased that actually it's been accessed quite internationally. I think that's one of the things that we're quite pleased about and keen to promote as sort of an international resource. So whilst a lot of it's been in the UK, we've had users from USA, Canada, Ireland, and India. But also, you know, we've actually even had a reviewer from Australia that's joined the team. So we're very pleased, particularly in this early days, as to how well it has been accessed. But we're always keen to get the message out a bit more that the resource is there, and working at trying to get it added to different websites and different organisation websites, and make people aware that it is a valuable resource that can be used. In terms of how it's been used, we're aware that obviously I mentioned it's been used in Sean Truick's review to help group and sort studies, but we're also been used to update some other systematic reviews. I think there's another 2. I can't remember the titles of them. I think one of them was on recruitment rate prediction. So yeah, we're hoping, you know, that we'll get faster in terms of keeping it up to date, and it'll be increasingly used for those sorts of studies.
Okay. Yeah, it's a big undertaking to keep it up to date, so it doesn't happen quickly, does it? We have one question that I can see that's come in, and this is from Anne Francis, and she says, sorry if I missed it in the presentation, but how were the list of topics and domains decided?
Yeah, that's fine. No, I didn't cover it in the presentation. So essentially, we started looking, and we built that framework based on some existing work from a paper by, I think, Caldwell. It is in the Orca publication. I can't remember what year it was, but they had essentially grouped 37 studies under, I think, about 4 headings. I'm trying to look now. Yeah, so they're under 4 categories, and they'd use novel trial design, incentives, provision of trial information, and recruiter differences. So my predecessor, Nick Harmon, and colleagues, they took that and they worked with the recruitment working group from the hub, and they developed a broader framework, broadened it out, added in the subdomains, and then that was discussed at the recruitment working group and in other with the co-applicants, and really refined through that process. We also obviously tested it and applied it and have refined it through the literature to make sure it was relevant to what was emerging. You may notice that on the first slide I showed, there was an other box, a G1. And we did include that in case people couldn't find an appropriate category. We did have some articles in there, but myself and Nick Harmon reviewed those and felt actually those were contained and within the existing categories, and we didn't feel it was right to add any particularly new categories at that point in terms of the data for this publication. So it's something that is an ongoing process in terms of making sure it's relevant, as you will see from the new domains that we've added. Hope that answers it.
Yes, thank you. I can't see any other questions actually coming in at the moment. Is there anyone that would like to unmute and ask Anna a question directly? No, there doesn't seem to be any. In that case, I'll ask one further question, if I may, while we see if there's any more coming in. And that was really to sort of see. You talked about it being extended to include not just recruitment but retention. But do you also have any plans to include ongoing research, for example?
Yes, certainly. This is something we're definitely keen to do, and we are at the process. We've had some people suggest some ongoing research, so we are looking to add that to the database. I think we just need to perhaps make some changes to the website, some practical changes, just to make sure those don't get lost in all the articles that are on there. We also need to just think a little bit about. Obviously, we don't want to recreate the SWOT database, which is available. But we recognise that people may want to submit ongoing projects that aren't nested randomised control trials, but perhaps are systematic reviews of recruitment interventions for primary care, for example, and they may not quite be relevant to SWOT. So yes, we are keen to include that, because one of the things that we're keen, and one of the purposes of this database, was to help people be aware of what research is going on and has been done to avoid duplication. So that is something that we'll probably be developing on the website in the sort of coming months. So please do, if anyone's got any research that they're undertaking, then please do get in contact and we'll try and get that up relatively quickly.
Okay. Oh, there's one more. Hang on, just bear with me a moment. So another question, do you have any plans to include non-clinical trials, e.g. trials of social interventions?
Now, it might be helpful if the person can clarify. We, obviously, in this particular data set that we're looking at, our search strategies were aimed at clinical trials, and that is the purpose of the database, to look at recruitment to clinical trials. But we did include any studies that came up in the search strategies that were not clinical trials. So, for example, if there was recruitment to an observational study, we did include it if it came up in the search strategies and we felt it met the other eligibility criteria. We did this at the time because we felt there could be transferable lessons that could be applied to recruitment to clinical trials. We are in the process of reviewing that, and we may make some changes to that going forward, just with the scope of the database, and also, that could be a larger exercise going forward if we were able to get funding to expand it to non-clinical trials and make sure the data that we included there was thorough. Does that make sense? At the moment, we just included what comes through from the search strategies. At the moment, we are focusing all the articles looked at recruitment within healthcare, definitely. But we have tried to include a variety of interventions. So I'd perhaps just want to question or want to have clarification on what they meant by social interventions, if that makes sense. I can't see the chat, by the way. Sorry, my computer decides.
Okay, it just says guest 14, so I'm sorry, I'm not able to tell you who it is. So maybe guest 14 can get in touch with Anna directly after this webinar if they would like to discuss it further, because I'm conscious that we have come to sort of 1:30, so I think we probably need to leave it there today, as we've really run out of time for any further questions. So thank you again, Anna, for a really interesting presentation. We have been recording today's webinar, including the question and answer session, and you will be emailed a link within the week so that you're able to listen to it again and share it with anybody else who might be interested. It will also be made available on the network website in due course. We're just trying to sort out the next webinar for October, and hopefully that will be finalised within the next few days. And then we will be able to promote that through the usual channels, but we're hoping to have a programme of webinars on an approximately monthly basis throughout this academic year. So I think it just leaves me to thank you all for listening today, and I hope you all have a good afternoon.